these doctors all speak English. Dr. Contreras is an MD from, he graduated from a medical school in the United States, and he speaks excellent English, of course. And then he also did a fellowship at Harvard at one point as well in his education. And he was planning to continue staying in the United States, living here and working here, but he was not allowed to practice how he knew was right when it comes to oncology care. And so his father founded this hospital in Tijuana in the 60s. And he said, I'm just going to take over my father's hospital and continue. And that was the best decision of his life. And we're very grateful to him for doing that because we have this option. So
he wrote a book too, correct?
Yes, this is his book. Well, he wrote a lot of books, but if you are interested in the type of cancer treatments I received in a very easy language to read, this is the book. It's phenomenal. He basically talks about how the immune system can kill off its own cancer cells and how they just aid in that process with their treatments. Super simple. So for those who are cancer survivors also, there are so many tips in this book that talk about, how not to get cancer back in your body. So lots of great health tips, nutrition tips, exercise, whatnot. But also he goes into all of the types of treatments they do and how important it is to do all of them together at the same time. So he has been fighting to get his treatment published and approved for use in the United States for over 20 years now. And what the FDA is telling him is, we need to approve one treatment. He says, but it is, I believe it's 19 treatments together that need to happen. And they say, we need to approve one. So you give us which one of those is the helpful one, and then we'll approve it. He says, but it's not the one, it's all of them together. They have to work synergistically. It's just a joke. It really is a joke. He says, how can I put temperature therapy, ozone therapy, medications, supplements, liposomal supplements, all of that into one pill for you guys to approve? I mean, that's just plain ridiculous. So he talks about each one of those types of treatments and how they all work synergistically in this book. I mean, my 10-year-old can read it and understand it. It's so well written. So definitely recommend this. If anybody's interested for themselves or anybody in their lives, this is it.
Yeah, Dr. Francisco Contreras, The Art and Science of Undermining Cancer. Let's just, you touched on a couple things that hit me. We talk about supporting the immune system to fight off cancer. Mm-hmm. Well, one thing that's very important to remember is that we all get bombarded by carcinogens that can cause cancer all day, every day. Mm-hmm. And that's why we have an immune system. Because if we didn't have an immune system to fight off those cancers, they would overproliferate and they would kill us. Mm-hmm. And cancer is a little bit like bacteria and viruses. It's everywhere that can cause cancer, and those cells that are bad, like a bacteria or a virus, start replicating too much in the body, and our immune system, but if our immune system's healthy, it just goes away and we fight it off.
Exactly.
And cancer is the same. And it's not surprising to me that, the FDA wants to approve one treatment, when in reality, it's a whole body treatment. We need a healthy body to fight off cancer. That there's not some one magic pill. And what's interesting too, Olga, is that when we do traditional chemotherapy, it's usually not one drug. They do a combination. So, why won't they approve this? There's more going on than just
because it works.
Yeah, exactly. Right.
Because it works very well.